at LCSW. I'm currently working at AmeriGroup as a discharge continuum liaison, working with our very ill members, trying to help them with their mental health and physical health. As we know, it's the combination of the two that makes the difference, right? I have a long history of leadership for about the past 22 years, and I've decided to take a little bit of a step back for a while and be a frontline staff. And I'm learning and reconnecting with so many things again. So I'm very happy to be in this position. I chose social work. Well, okay. And they all looked at me because all the other kids wanted to be astronauts and ballerinas and doctors, firemen, and I was going to be a psychotherapist. I just remember from a very young age always feeling like I connected with people. If my mother took me shopping and she couldn't find me, all she had to do was walk to the front of the store. And there she would find me at 6, 7, 8 years old with a complete stranger sitting and telling me their life story as I looked at them and nodded my head. So I knew that I wanted to help people before I knew what it was called. When I was in undergraduate in human services, I was talking to my advisor, a man by the name of Dixon McLean, who has since passed away, who was just wonderful and saw the world through such different, wonderful glasses. I always aspire to be as positive and as open-minded as Dr. Dixon McLean. And I told him I wanted to be a therapist and that the only way I could see to do that was to go into psychology and be a clinical psychologist. And he goes, well, I don't want you to think that's the only route. And he opened up his advising books and all the different catalogs that we had at the time, because getting online was brand new at the time. Boy, did I just date myself. And he showed me, let's take a look at what you're wanting to do. Look at the names of the classes. What resonates with you? And when we got to the social work department and the catalog and the definition of what it took to become a MSSW, Masters of Science in Social Work, the titles of the courses, learning to help people, personality disorders, connecting with your community, all of those titles resonated with me much more than the clinical psychology courses seemed to. And he told me about what it could mean should I ever become a licensed clinical social worker. And he outlined those steps for me. Well, that sounded like exactly what I wanted. So I scheduled an appointment with the social work advisor, went for the appointment. They educated me about the track to become that, where I could hang that shingle as a licensed psychotherapist, should I choose to do so. And it was LCSW. And that set me on a course for the next 6 years of my life to get my degree in 2 years, to get my license after those 2 years with the appropriate supervision and taking the state exam and cutting my teeth on what it meant to be a community social worker, a medical social worker, and with that goal of becoming an LCSW. It wasn't. I thought when I started out, I got my first job as a medical social worker for a home health and hospice agency. Within 1 year of working there, for $30,000 a year, I might add, and me thinking that I was rolling in it at $30,000 a year. But remember, I was in my mid-20s, and this was in the mid-90s. So I thought, okay, this will do in Knoxville, Tennessee. But no, I thought that I was going to bide my time to get my license, hang my shingle, and be in private practice. And most people will tell you, I'm going to be in private practice. And then they do a little research to find out what it means to be in private practice. And they're like, I don't think I want to do that anymore, because it's a lot of work. It's a lot of responsibility. It's endless consultations with insurance companies like we work for now. And no, so when I was there, and within a year, we were bought out by Covenant Health. And in Knoxville, Covenant is the largest health network, right? The health system. They bought us, and there was an opportunity to become a director for the department. And I was competing against people who had more years of experience as a leader than I had been alive. And I thought, I don't understand how they could possibly hire me, but I've always been kind of a go-getter. I've always been a person who wasn't afraid to try, and I got the job. And I'll be honest with you, I shouldn't have gotten that job. I was too young to have that job. So I had to learn very quickly. I made some mistakes, but I eventually found my way to, they ended up uh, downsizing. So I was a part of a reduction in force along with 30 other colleagues. That was my first experience with a reduction in force. Not my last, unfortunately, but my first. And that was one of the things that, you know, I was kind of warned at when I was in graduate school. If they make cuts, if you work as a part of a larger system and you are a novelty as a social worker, even a licensed clinical social worker, you are oftentimes the first one up for reductions in force because you can't bill at the speed of a nurse and you're not an MD. So that's going to be a reality for you in your career, Bobby. Be mindful of that as you move forward. And boy, they weren't lying because I have been a part of 3 reductions in force, each one being very painful, each one during a time that I was at the top of my game. I was getting outstanding reviews. Everything was positive. How could we continue to function without you? And then boom, you're on the chopping block. So no, I didn't think that. But very on into my career, when I came back and worked for the Covenant Health System again, I managed East Tennessee's largest outpatient center, Peninsula Outpatient in Knoxville. And by then they were teaching, as a part of the Covenant Health System, they were teaching leaders how to lead. So I had about 100 hours over the next 2 years on how to be a leader. Too many times we put people in leadership positions with no training, and they think just because I'm good at my job, I'll be a good leader. And organizations think that just because I'm good at my job or they're good at their job, they'll make a good leader. And the two are not simpatico. They're not the same thing. You can be great with patients, members, clients, whatever people are calling them, and be horrible at leading people. So I had to invest myself in that. And I hearkened back when I first started that and I was learning to be a good leader. Very shortly into that, I had to go and do a reduction in force with people I was managing. Pick 4 case managers and 2 therapists and tell them bye-bye. And I remember going and telling my father about what I was getting ready to do, who had been fired from a job, a factory job. He and my mother both worked in factories to send my sister and myself through school. And my dad said, you know, son, I want you to be really thoughtful as you go forward. You have people's livelihoods in your hands, how they pay for their bills, how they keep a roof over their head, how they feed their children. You think about that happening to you and what I went through when I was laid off from my job, what we went through as a family. You think about that every single time you sit down with someone that you're letting go for whatever reason. And those words have echoed with me for 20 some odd years every time I've had to have those conversations. So no, that's a long answer. The short answer is no, I didn't think I was going to be a leader. When I became a leader, I had to invest in myself, and thank goodness I worked for a company that invested in us and develop leadership skills that have served me well to this day. That's how you become a good leader. Just because you think you want to be a leader doesn't mean you're going to make a good one. More money, right? More money at the top of the list. If anybody wants to act like that some decisions aren't based on money, they're not being honest. The desire to want to change a system, but you have to be willing to do it slowly in baby steps. It will be like working for the hardest patient or member you have ever worked for, while at the same time maintaining the epitome of professionalism. So it is a whole new ballgame, and it just takes time. Tape once you're in the position, because organizational change takes place very, very slowly. The challenges of supervising a large team are very difficult, very different, I should say, from managing a small team. So the size of the team impacts that. And the fact, like I said earlier, that we're up for the chopping block oftentimes as middle managers. I have risen above middle management a time or two. I stayed for as long as I felt good about that position. I guess what I want to say more than anything, and let's just be honest, so many positions are going to be replaced by artificial intelligence. in the near future. I think over time, that will eventually even impact providers. I think it will absolutely impact case management. I think it will, if we are tired of doing it because it seems like it's rote and I have to do this in order to do something else, there's no reason in the world a computer won't be able to do that soon. So we have to be mindful of all these things as we go forward and to think that, okay, what are one of the last frontiers for social work? Social worker who wants to be a clinician, right? Not all social workers are clinicians. Some of them go the administrative route and never look back. I always was clinical. That it's very challenging to help a human being with complex problems in any circumstance. And that requires so many skills that I can't imagine that a computer would be able to do that anytime in the near future. So thinking about how technology might impact a position that we're in 3 to 5 years, positioning ourselves so that we don't become victims of that we always have an idea of where we can step to next. I think managed care is going to become very different within the next decade. I think that national health care is coming, and that will tremendously change the role of managed care organizations. So we always just need to be eyeing the next thing to take care of ourselves, because if we don't have a job, we're not helping anybody. If we don't have a job, we're not leading anybody. Because so many companies want to act like that's so hush hush, and they make it almost a dirty word. And some even write it into their policy that you can't discuss salary or hourly rates, and if you do, you'll be terminated. Why do we think that is? That is to cover their asses, because they know that if people know what each other's making, it will lead to almost a union approach to say we deserve equal pay, right? So when I started making that $30,000 a year, I thought I was poo-pooing and high cotton. I thought I was the cat's meow. Then they promoted me to the director position. They started giving me $45,000 a year. Woo, it's making it rain. I just thought that was fantastic. Then I eventually, after the layoff, I took a step back, went back down to not making very much at all, then became a clinical supervisor at Peninsula Outpatient, and they bumped me up to $65,000 a year. And I thought, oh my gosh, absolutely, woohoo, this is great. Then I became a clinical director at Peninsula Hospital, and that put me up to $75,000 to $80,000 a year. Then I became the clinical director of Peninsula Hospital, and that put me up to right between $80,000 and $85,000 a year. Then I left to go to managed care and made similar to that. That was when I left to become the manager of utilization at United. Then I left that and managed a private residential facility for about the same. They were all private pay. It was a beautiful lodge in the mountains, each patient paying about $25,000 a month in cash to be there. So very wealthy individuals. And that's an interesting story too. Remind me to tell you that sometime, because I had an interest in finding out if money were no object, would mentally ill people get better care and have better health outcomes than poor people? Because they have unlimited funds. And I'm talking about families that would fly in on private jets and hire a limousine to take them from the airport in Knoxville to this lodge in the Smoky Mountains, those kinds of people. And that question, will people get better care if they are able to pay anything for it? Will they have better health outcomes? You know what the answer is? No, they do not. No better outcomes than people on TennCare. It just depends on the provider. Okay, so then I left that to come to Amerigroup and be a manager. And when I left, I was, with bonus and everything, making right at 6 figures or a little bit better. And that was, I was, talk about enjoying the ride, right? And, if you do some research, you'll find that people who make that 6-figure mark, the problem is once you get it, keeping it. because the number of times that people lose their jobs making a six-figure salary is 7 to 10 times more frequently than people making below that. And if a company is looking to save money, where can they find that? Here's somebody making six figures. Can we really do without him? So you have, it's a dangerous zone to be in when you're a social worker, because you're in that zone where you're making, I talk to people, some of my friends working here and there and everywhere, making $45,000, $50,000 a year, right? And they've been in that job for 12 years. Then I have friends who have been in the jobs in leadership, and just like me, they've had more turnover than their colleagues who are on the front lines. So one of the things that was appealing to me is I made the decision that it's time for me to step back for a while. I heard a quote recently, and it really resonated with me. It says, when you don't have to work as hard, then don't work as hard. When you're in a position that you don't have to work as hard and you're stressed and you're not spending the time with your family that you would like, and are you really enjoying your life? If you don't have to work as hard, then don't work as hard. So my husband and I talked about it, and we're in a position to where we can pull back a little bit. My mother lives in a guest house that we built for her, thanks to the six-figure salary that I carried for almost 5 years, right? Built my mother a guest home. She lives here. We pay cash for just about everything. We're very, very careful with our money, our planning, our investment for retirement. I'm able to pull back a little bit now. And that pulling back has given me an inner peace. It's given me a time to focus on what's important. And for me to make the decision in the future that I might want to go, excuse me, that I might want to go back into leadership, maybe, who knows? Who knows what's around the corner with us as a company when we merge with Beacon, as we make different changes? We'll see. Maybe things will present themselves elsewhere. We're building one of the state's largest psych hospitals in Knoxville as we speak. It's been delayed a little because of COVID, but I know it's coming. So there's a lot of opportunity in the future should I decide to pursue it. But right now, I'm perfectly content working with members in this capacity and remembering what got my heart going to begin with, helping people. So I'm able to do that in a new way now. So this is exactly where I'm supposed to be for right now. I got to tell you, clinical psychologists have always had a higher starting salary. Especially those that are able to do testing, psychological testing. And when you are able to do psychological testing, because of the demand for that, both in the school systems and just in private practice, in order to get this, so you can go do that. So some patients, I have to be tested for this to see if I qualify for this. That gives them a certain amount of job security. I've talked to a few LMFTs who feel like they are in the same boat as LCSWs. And LPCs. Now, more and more LADACs, those that are licensed alcohol and drug counselors who may not even have a baccalaureate degree, I think what we're going to see, and the peer recovery movement, I think because those are cheaper services, I think we're going to see an increase in how much responsibility they're given in taking care of patients and members, because that means that they are paying out less because they want to be paying for us. They can pay them, and they can make them clap their hands for a $12 to $15 an hour salary or hourly rate. I think we're going to slowly see an increase in the number of paraprofessionals. Historically, I've called those folks paraprofessionals, assistants to the professionals. Not in any derogatory form, it's just the hierarchy. I think we're going to see their ability to do things increase. I think they're going to try to put that up against their outcomes. In other words, do we have any better health outcomes from case management, just as an example, case management through the MCOs being completed by a licensed person, or could that be a peer? And if it's a peer, if we can get the same health outcomes and get the state to agree to it, bye-bye licensed folks. Have a good life. That's just business. It's about doing more with less. And let me tell you, I want to give you the naked truth. Naked, Nekkid. That's the country version. That means you're really serious. The naked truth. That this is not a role for somebody who needs a guarantee. If you need a guarantee, become a nurse. There are no guarantees, and RN specifically. There are no guarantees. It's a little bit of a wild card with what we're going into now. If you want to remain on the front lines and not be a leader, okay, great, good for you. Nothing wrong with that. Perfect. I have friends that say, I just want to be a therapist. I just want to bring individuals in my door, have my 50-minute hour document after it, close the door. That's what I want to do. I don't want to lead. But if you're interested in leadership, it's not for the faint of heart. You will experience turnover in your life. You will experience turnover in your leadership role. On average, for me, it's been about every 5 years. Something comes along that you could never foresee, or that you know is coming and there's nothing you can do about it. To teach yourself to lead. If your company does not invest in that, and that's the majority of companies, then you have to take it upon yourself to do that. And there are a couple of books that I would recommend to help people learn to lead. And I'm going to blank on the author of one, but the first one is called Hardwiring Excellence, and it is by Quint Studer, S-T-U-D-E-R. It teaches people how to lead in a healthcare-based organization, how to establish goals, how to put things in context that people can understand them. Oftentimes you have people on the front lines, they don't want to hear about the financials other than, are we making money or losing money? So we got to put it in a way that they can understand and attend to, and to understand what they need to do exactly to contribute to that financial bottom line to get where you need to be. Because a lot of times, for the first time when someone steps into a leadership role, it's the first time they've ever had budget information put in front of them and that they have to operate within. And a lot of people, they won't say, I don't know how to do that. That budget makes no sense to me. So you have to figure out budgets. You have to understand them. So you have to go and do some research. And we are in the age of information. All the smartness, all the things that mankind knows is right here. Right? So we have no excuse not to use that to be able to research what are budgets. And you don't have to be Warren Buffett. You have to be someone that can sit down and go through and understand financial bottom lines, where money is going that it should go, where is money going where it shouldn't go, and how you can contribute to increasing the black and decreasing the red, right? The red ink. The other book is called Crucial Conversations, and I'm blanking on the author, but it teaches you how to have uncomfortable conversations, because oftentimes that's where managers blow it, right? They don't know how to set somebody down and have a proper performance conversation. And one of the first things that it teaches you in crucial conversations that really spoke to me and my heart as a social worker was start with heart. I'm going to give you an opportunity to tell me why this is going on, because I know this isn't you. I've seen you in so many circumstances where you always greet people with a smile. You know the names of my family members. I just enjoy you so much. So I know you to be a person who cares and wants to do the right thing. Help me understand how that is a comparison to your frequent absenteeism, the fact that you're behind in your notes. So start with heart. That's a very different conversation than setting you down and saying, your notes are late, and a note can't be put in after 24 hours. So what's the problem? What's going on? Why can't you do this? So there's ways of getting people to do what you need them to do. And if they don't do those things, you can help show them the door. And what we call is they will performance themselves out. Because if they are held to certain levels of accountability and they are not meeting those goals, it's not you. It's not you as the manager that's keeping them from hitting those goals. Those goals are in black and white, and I update them about where they are. They always know where they stand. And look, if this doesn't improve, then we're going to have to progress in the disciplinary process. What are the barriers to getting you there? Let's write those down. And then I'm going to make some suggestions about resources, people, additional training, whatever, in order to help get you there. But if you don't get there, this may not be the right fit for you. So oftentimes, 9 times out of 10, they will be making plans and they will be submitting their resignations if they can't do it. Mm-hmm. So they performance themselves out rather than you firing them or writing them up every time you turn around. Here are the goals. Here are the time frames for you to hit those goals within. If you don't meet those goals, we will have another step in the progressive disciplinary process. Mm-hmm. People see the writing on the wall. This is not for me. I can't bullshit this man. He knows what he's doing. I'm out.